The National Coronavirus Command Council has decided to enforce a nationwide lockdown for 21 days with effect from midnight on Thursday, the 26th of March.
That was 5 years ago in 2020, when life as we knew it came to an abrupt halt around the world.
China closed off Wuhan, a city of 11 million people, to contain a deadly virus.
It has not been tried before as a public health measure.
In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher.
In the blink of an eye, between one sunset and the next sunrise, the country learns of working from home, going to school through the lens of a computer camera and shutting down industries.
Fellow South Africans, this is the most definitive Tumamina moment for our country. If we act together, if we act now, and if we act decisively, I am sure we will overcome it.
In this mini podcast series, the Jacaranda FM news team will help tell the story of COVID-19, from the so-called Sunday night family meetings with the president to the stories of heartbreak, survival, and learning how to fit a mask. We tell you how COVID-19 shaped and changed our lives forever and educated humanity about our fragile existence. The stories we shared in the past week spoke of hardship, grief and loss, but it had something else in common: growth, hope, and in some cases, change for the better. Cliff Shiko and Lebogang Ndashe dedicate this podcast to resilient South Africans and the sectors that refuse to accept defeat.
Before the pandemic, very few South Africans knew about social distancing, washing their hands regularly, and even using a sanitizer. Professor of Medicine at the University of Cape Town, Linda Gail Becker, says there are two good things that came out of COVID-19, especially here in South Africa. Although she questioned some rules like the restriction of movement, she believes the government handled the outbreak well.
There were good and bad. I think the good was the amazing leadership from the National Department of Health, a real involvement in making sure that the population were informed and, messages were shared. I think the downsides perhaps were around, we obviously had never met a pandemic like this before. I think we may have not always, responded to evidence as quickly as perhaps we should have. I think some of the lockdown aspects in retrospect may have done more harm than good.
According to her, the pandemic made more people to be aware of how viruses are transmitted by practicing good hygiene to avoid the spread of preventable diseases and differentiating between vaccines and treatment.
I think people started to understand viruses, airborne transmission, but I do think there was much greater awareness of how infectious diseases are spread. And of course, yes, an element of that is self-care and hygiene and, being aware of living in the world and being exposed to infectious diseases. In some cases that we may have taken that to extremes. I think sort of washing the outside of our groceries was not necessary at all.
However, Becker believes that vaccine hesitancy will likely continue. She says during COVID-19, social media was flooded with misinformation and hopes that health institutions will learn how to communicate better.
There has been a lot of talk about vaccines and vaccine hesitancy. So I think that conversation probably isn't over. I think there has been recognition, and maybe there needs to be more humility around this, about how we as a scientific or a health community, how we communicate information, how we handle evidence, and how we transmit that evidence to ordinary citizens and people who are in societies. And if there are future pandemics, that we have a clearer approach to how we do this in the future.
Looking into the future, Becker emphasizes that public health interventions should help us to mitigate negative social and economic impacts associated with pandemics.
As COVID-19 swept through South Africa, an industry that's often overlooked suddenly got a whole lot of attention. The way we laid loved ones to rest left a wound that many of those in the global community are still healing from. This was the funeral industry's biggest challenge. As we reflect on those we've lost and the deep scars they've left behind, we spare a moment for those who were at the front line and dedicate a moment to those who helped lay our loved ones to rest. In Johannesburg, a city already struggling with limited burial capacity, authorities found themselves racing against time and ran out of space. 39 out of 42 burial sites were filled to capacity. Health protocols further strained this crisis, forcing the city to implement stringent sanitization and attendance control at funerals while managing the unbearable emotional burdens on families.
We had to work very closely with the funeral directors, but more importantly, the compliance issues were non-negotiable. So there was a number of burials in the city of Joburg, but we had to make sure that firstly our staff were all had the vaccine. They were one of the first lots that were given preference when it came to the distribution of the COVID vaccine. They were then trained in terms of how to ensure compliance at the cemetery, at the crematoria.
This is Jenny Mortley from the Johannesburg City Parks. The devastation pushed Johannesburg into crisis. Mortuaries and crematoria, already stretched thin, were faced with demands beyond their capacity. There was a dramatic rise in cremation rates, and families were left with almost no alternatives. Johan Russo, chairman of the Funeral Industry Reformed Association, shared his concerns with Jacaranda FM News, saying that the funeral industry was pushed to the edge, and without reform, it could collapse in the face of another health disaster.
What the funeral industry experienced is that they had capacity constraints in terms of storage of deceased. Whether it's, one deceased or whether it is 10 or 100 deceased, they didn't have the capacity thereof. And that caused a problem. Deceased was wrongfully given to people in many cases because all the deceased was wrapped up and covered up in body bags, so people couldn't identify a deceased. Government also said that a coffin needs to be wrapped up, which is absolutely unacceptable because if coffins was South Africa had a SABS standard, there wouldn't have been the need for a coffin to be wrapped in plastic type of environment. And I think over and above the funeral industry, the challenges that they've had is the fact that the families couldn't conduct what they normally do in terms of their traditional and cultural requirement to exercise their rights in terms of their cultures and traditions. And I think that's the biggest impact on the consumers. And they were also forced to do a funeral within a specific timeline, which is also unacceptable because it was totally unnecessary.
With the burial space crisis continuing to affect Johannesburg, the city has pledged to address the issue. But the question remains, how soon will it be enough to prevent a future collapse? Another key component on the road to healing is traditional leaders. Their work often requires physical contact, and the risk of COVID-19 became a major barrier. Adding to that, they were excluded from government health strategies despite their integral role in community well-being. Dr. Mpoma Sondo, director of the African National Healers Association, still believes they should have been recognized as essential workers.
We also helped provide safety guidelines, obviously with what was communicated by the World Health Organization, what the government communicated. And then we also worked with policy makers to ensure that healers, find a safe way to continue their work and adhere to the public health measures that were put in place, and also ensuring that African National Healers Association, the members are protected.
As the pandemic stole the opportunity for traditional healing rituals, families were left to grapple with the loss of loved ones without the comfort of cultural ceremonies. The emotional toll was compounded by the absence of communal healing practices, leaving many searching for ways to cope with the grief during one of the most challenging times in history.
Most people turned to traditional healers for solutions, for emotional support, for spiritual guidance, for imbiza, immune boosting remedies during the lockdown, because there were obviously a lot of restrictions and ancestral rituals were also limited. Healing ceremonies, we couldn't do certain things. It was a very challenging time for communities, and I actually can't believe it's been 5 years since that time.
Through it all, though, especially through the voices we are hearing in this podcast, we've witnessed communities rise to the occasion, which leads Cliff Chico to one of our most vibrant communities, schools.
Teachers and students had to adapt to a hybrid learning and rotational classes in the blink of an eye, while it undeniably had an impact, especially on those with limited access to resources. It showed the world what could be done. After the COVID-19 outbreak, entrepreneur Sean Fox founded Centennial School here in Johannesburg. The school is a technologically driven learning center preparing pupils for the digital world of work.
Actually, the school was born out of COVID, so it's one of the great pluses of COVID and lockdown is Centennial Schools. I'd always wanted to start my own school, and with lockdown, with COVID and obviously lockdown, it for me was the perfect opportunity to look at this epiphany of the world has changed. So how do we change things? So post-COVID, so much has changed. Business, how we did business, how we corporates run, how we shopped, how we socialized. But the one thing that didn't change, of course, was education. Schools went straight back to doing what they were doing pre-COVID. So the school is completely modernized for the 21st century.
He says the pandemic prompted a rapid change in education delivery and online learning became the norm.
So I do think that post-COVID, we completely reimagined how schools should be. And we are very strong now in offering sports like esports. And esports is on the extracurricular program, like you're going to choose rugby or soccer or water polo or any of those sports. Esports is going to be one of the main features. So that definitely is a strong thing that's come out of COVID and is actually being recognized for the right reasons now.
Fox adds the digital divide in the schooling system can be bridged.
How do we bridge it? I think the private sector can play a very strong partnership in terms of providing connectivity, and there are really smart devices that students will have access to. In terms of education, what did we learn out of COVID? 85% of the jobs that our students right now are going to go into by 2030 do not exist. So our education system has not adapted to prepare for a skill set for students who are going into those careers.
Meanwhile, he's not the only one who realized the value of alternative school platforms. Colleen Cronje runs a virtual school in Pretoria. She says during COVID-19, her school, Brainline, welcomed new pupils after their schools were closed due to the lockdown. Adding that as a virtual school, they were able to provide the pupils with a safe and uninterrupted alternative.
I think many families will tell you as soon as COVID hit, they were looking around at what kind of schooling options were available to them, because their one desire was that their children, the learners, would not fall behind. And of course, as they Googled, they came across quite a few online school offerings out there in South Africa already and available to accept them.
Both pupils and their parents were faced with a new way of learning and they had to do it together.
I think parents and learners alike found the online school environment very, very strenuous. They found it to be quite different environment to what they were accustomed to. Parents discovered that they had to be involved more intensively than they thought they would have been involved. With all of that, the stress and the strain of the environment that we lived in at that point in time, them trying to work from home and trying to find a little space, little place where their kids could learn and attend an online school, I think was very stressful for many parents. So it would be a lie to say that they adapted easily, because it impacted the entire family.
It was not only the teaching industry that adapted successfully. Peter Kilbrick is the managing director at Andile Solutions, a financial tech company in Johannesburg, and says they managed to retain their workforce during the pandemic.
Our clients were in a bit of a predicament and we were able to fill some of the gaps for them. So to a certain extent that created some opportunities for us. So it's not as if the business just died. And from the outset we made a decision that we're not going to lose any people or put them in a very difficult position. And we are actually proud to say that we've succeeded. We've kept everybody. One of the steps would have been to maybe start decreasing all people's salaries if it came to that, but we were able to pull from other resources and we maintained the whole workforce as is.
He says for them it was much easier to adapt to having meetings on a virtual platform like Zoom to carry on with their jobs.
Yeah, that was actually quite easy for us because we were set up in that sense. I know of a friend of mine at one of the big organizations, their first thing was where will they procure 500 computers and stuff like that. But we were actually ready to do that due to the nature of our business.
Today, 5 years after the first lockdown was implemented, it's clear that not even a pandemic could get us down.
It gave me time to evaluate myself, especially when I was alone, maybe in the house. I would take time to just look at the things I could change about myself, and then I think I discovered new skills. Now I found that I love being a social media person. Yeah, so that really helped me a lot.
I would say self-introspection, basically. That's a good thing that came out of COVID, because made me think or question life. If COVID did not happen, I saw life in a different angle from then. Another thing that really, I would say COVID affected me personally when it came to mentally, I overthinked everything.
COVID-19, some of the other positives were, there was a lot of good family time. Some of the bad things maybe was, I think, especially my kids, they've lost out on a few crucial school years. Overall, I think, was it a good or a bad thing? Yes, I can't answer that question.
For Jacaranda FM News, I'm Cliff Shiko.
While the world may never return to what it was before, the lessons we've learned, the strength we've discovered in ourselves will guide us forward. Together, we will continue to build a South Africa that is stronger, healthier, and more united than ever before. Here's to the resilience of South Africa. I am Lebohang Dashe.
COVID Chronicles, 5 years after masks, thermometers, and my fellow South Africans, is an original Jackpot podcast brought to you by Jacaranda FM News. Jacaranda FM cannot be held responsible for the views and comments expressed in this podcast. Follow Jacaranda FM News on Facebook and X, or go to jacarandafm.com and click on News. Listen to more episodes and original series at jacarandafm.com. Click on Jackpot or wherever you get all your other podcasts.